Alright, you're welcome. This is Celebrity Pharmacologist, and today let's look at the topic on the board. The topic on the board says understanding hypertension and antihypertensives. If this is your first time of coming across any of my video, please do want to like, share, and drop your comment in the comment section. Don't forget to follow me. Save this video also, especially for those that are in pharmacy and medical practice. Now let's discuss hypertension. Before you can understand what hypertension is, you need to know what blood pressure is. Let me illustrate this with a diagram. For instance, I want to pump water. I want to send water through this artery to this cup. I want to send water through this artery or through this pipe to this cup. The force of which this water will push against the walls of this pipe, that is the pressure we're talking about. So when we say blood pressure, it's simply the pressure at which the blood will push against the walls of the artery or the blood vessels when the heart contracts to pump blood into the body. That is a simple definition of blood pressure. Now, assuming I have this as a pipe, let me say pipe A, then I have another pipe that is a little bit wider with a bigger diameter, a larger diameter, something like this. And this is the cup. If the heart tends to push blood from this through this pipe to this cup, you will notice that it will need lesser pressure. Even mere looking at it, you know it very well that if they should tell you to put water in your mouth and push it through this pipe of this size, you will need more pressure for this very one compared to this, because this one is wider. It has a wider diameter. Here you just pour the water and it goes out to the cup. But for this, you need to what? Push and add force to it. So what then is hypertension? When there is constant demand for pressure, a higher pressure to pump blood, for the heart to pump blood around the body, that is what we call high blood pressure. When there is high demand, when there is higher pressure, when there is high demand for high pressure to pump, when there is demand for high pressure to pump blood around the body through the arteries, then that's what we call high blood pressure. Normally, we say that the reading, the normotensive for blood pressure is around 120, 80. The reading between the normotensive and the hypertensive is arbitrary. That means there is no fixed value. Rather, we have a fixed range of between plus 10 or minus 10. Plus 10 minus 10. So if I should tell you to remove 10 from this 120, you will be having 110. That's 110, 70. 110, 70. Then if I should tell you to add 10 to this, you will be having 130, 90. So any blood pressure that falls within this range, it's considered normal. I want you to know that when this blood pressure, when you're having a blood pressure above 130, 90 persistently, like for a very long time, you check today, check tomorrow, check almost every day, you're having something higher than this, then that person is said to have hypertension, high BP. In same scenario, when someone is having below 110, 70, maybe the person is having 97 over 60 or 97, 50, then this person is almost gone. All right. All right. It's very good for you to know it that this is called the systolic and this is called the diastolic. The systolic pressure simply tells you of the pressure that the blood exerts against the artery when the heart contracts to pump blood into the body. Whenever the heart contracts to pump blood into the body, that is what we call the systolic pressure. Diastolic is when the heart relaxes, the pressure that the blood exerts when the heart relaxes to refill before it can pump again, and that is the diastolic. Both of them are very, very important. None should be higher than the range that you've seen here. Now let's discuss about the common causes of hypertension. Many people used to say that when you think too much, it will lead to hypertension. That is not correct. Thinking is not the main cause, or it's not the cause of hypertension. Like I want you to know that hypertension is not a sickness. So it's not something you say that you don't cure hypertension. You have to go for the underlying causes, manage it to the minimum. You don't cure hypertension, you don't cure it. You do the right thing and you get out of it. It's not about thinking. The major causes of hypertension, number one is genetics. And what do I mean by genetics? Number two cause of hypertension is obesity. Number three, it's excessive intake of salt. Excessive intake of salt or spicy food. Number four is lack of physical activities or physical inactivity. Physical inactivity like exercise. The last one which I will add here is excessive intake of alcohol and smoking. Excessive intake of alcoholism and smoking. I've seen countless number of people arguing if alcohol is good for the body or not. One thing I will tell you, I'm not here to discuss about. I made a video when I said nothing is too good for the body, and I also said nothing is too bad for the body. You see this alcohol, one thing you should ask yourself, if it's good for the body or not. Ask if it can be given to children. Ask if alcohol can be given to pregnant women. If it cannot be given to pregnant women or cannot be given to children, then you should know that it's not something you should be consuming. Whatsoever, just have that in your mind. Whatsoever that cannot be given to children between 3 months, 2 months, little kids, or even below 18 years, 17 years, whatsoever that cannot be given to that child below those age, or cannot be given to a pregnant woman, it's not advisable you consume them in excess. So the next topic now, we should be discussing about the management of hypertension. There are basically two ways which you can manage hypertension. Both of them goes together. Number one is non-pharmacological approach and pharmacological approach. We have the non-pharmacological approach and the pharmacological approach. The non-pharmacological approach simply means the advice your medical practitioner will tell you, like your doctor, when he says, please engage in physical activities, avoid excessive intake of sodium, that's salt, reduce the consumption of alcohol and smoking, watch your weight, watch what you eat. Those are the non-pharmacological approach, and it's very, very crucial. It's very important that even people who are not hypertensive should look into it. Now, the pharmacological approach is the one that you introduce drugs like the calcium channel blockers, talking about nifedipine and amlodipine. Then ACE inhibitors like lisinopril, AROBs like the Vasatan. In our next class, we'll be discussing drugs used in the management of what? Hypertension. We are going to be comparing drugs in management of hypertension. Goodbye until next time.